I'm in Khayelitsha, where Médecins Sans Frontières, also known as Doctors Without Borders, are doing great work towards ending drug-resistant TB. We're about to head over to the Ubuntu Clinic, where we're going to speak to doctors and patients to find out just how the fight towards ending DRTB in this township is going. As one of Cape Town's busiest townships, Khayelitsha is particularly prone to transmission of infectious diseases.
The prevalence of TB in Khayelitsha is considered to be extremely high. In technical terms, it's 1,600 new cases per year per 100,000 population.
Originally here to focus on providing HIV services, MSF saw a vital opportunity to help those with TB and drug-resistant TB.
74% of the TB cases are HIV positive. So they need HIV treatment and they need TB treatment. Let's do it in the same place. We decided to decentralize the treatment here in order to reduce the time to treatment.
Today, the MSF clinic has opened its doors to journalists from around the world to learn about the decentralized model and the many benefits it has for patients.
Patient support is a key component of making the decentralized model of care work. We wanted a patient support program that encompasses the whole treatment journey. Our patients start their treatment in their community, so 5-6 days after they are diagnosed, they get to start their treatment. DRTB is not the end of the world. Once you're culture negative, once you're not infectious and you're taking your treatment well, you should be able to take it at home on your own because you're a responsible person. We need to trust our patients. We celebrate when they do well and also support them appropriately when they don't do well, when they are struggling, and also normalize the fact that treatment interruption is part of the journey. We're not perfect. We all struggle, and that if we work together, we can overcome those struggles.
When you decentralize, you also have to go about and make sure you have appropriate infection control in place. You will always have, to some extent, patients in your waiting room who you do not yet know they have DRTB. So it's very important to ensure that your infection control measures are thought through and addressed. So whirlybirds use the natural force of wind power to turn and create negative air pressure. It pulls all those infectious particles up and out of the clinic.
With more services and better treatment, stigma is also being reduced.
What you have to do to reduce stigma in the community, either for HIV or TB, is a lot of community mobilization and community education. And that's where our civil society partners come in.
Stigma reduction is helped substantially by engaging TB survivors in supporting new patients.
I know this chain is not easy, and then even the medication is not easy to take the treatment for 2 years. Each and every day you have to go to the clinic just to swallow 20 tablets and then the injection. Sometimes the family, they didn't even want to see you in the house, even the community, because they didn't understand what XDR is. I need to help the patients because I know what they're going through, because now I'm a drug-resistant TB counselor. I know whatever the nurses they're dealing with the patients. I know the way they were talking with the patient, because I was also the patients.
We normally in a community know that TB is only for people that are HIV positive. So I assume also myself, which means I have a TB, I'm also HIV positive, but it was negative. As I meet the counsellors of MSF, it's when I get all the clarification. They tell me everyone can get a TB anyway, doesn't matter who you are.
The challenge is now moving to zero. For the moment we have managed to stabilize the number of drug-resistant TB, we need to cut it down, and this we haven't managed to do up to now.
There's still a long way to go to beat TB, but the work of the MSF and the Ubuntu Clinic have made the first strides towards an inclusive form of treatment that's pushing things in the right direction.
They are playing a big role in the community. Normally people, when they have TB, they die because no one cares about them. You have TB, you've been isolated from the other people, they don't want to come next to you. But this clinic will play a big role of they are supporting us. They are there for us. Anything we need, we report to them.
Once I started here with MSF, I had my own preconceived ideas about patients with drug-resistant TB. And one of the things I've realized is that our patients who have drug-resistant TB are just like you and me. We need to treat everybody like we want everybody else to be treated, or like we want ourselves to be treated.